front bench. Her delivery of support to make sure that nobody is penalised for doing the right thing is incredibly important. But as she says, there is no employer for those who are self-employed, so it has to be delivered through the benefits system.
With flight restrictions across the world, many of us have constituents who are stuck abroad. Can my right honourable friend provide reassurance that there is consular assistance available and that he is working closely with the FCO so stranded constituents in countries which have imposed flight bans can get home?
Yes, that's an incredibly important point that I discuss regularly with the Foreign Secretary.
Vicky Foxcroft.
Mr. Speaker, food banks will be under unprecedented pressure in this period. What measures will be put in place in order to provide volunteers with protective equipment? And will he consider requiring supermarkets to put aside stocks and provide donations to food banks in this crisis?
Well, as we expand the amount of protective equipment, I think that we should look to and work with food banks who have an incredibly important role to play, and I would certainly urge supermarkets to do what she asks.
John Burren.
In welcoming this package of measures, I very much encourage my right honourable friend to encourage businesses to be as flexible as possible so that employees can work from home, to step up testing for emergency and public sector workers. But can I also ask him to particularly focus on the elderly and the vulnerable who are living alone? Because there is a risk in this sort of scenario that they become inadvertently ignored by the system. What more can the government do to reach out to these people, whether it's by looking at the voting register or whatever, to ensure that they're being catered for, because they are particularly vulnerable if they're living alone?
He makes an incredibly important point. One of the reasons that we have held off from taking measures like this for as long as we have is because these measures have quite significant downsides, many of which have been discussed in this chamber today. So, of course, I urge the people to follow the advice that my honourable friend gave, and for communities to come together as much as possible to help each other through.
Thank you, Mr. Speaker. Secretary of State, we need a plan for scaling back schools. Teachers are saying to me that they're parts of a mass collection of people every day, and they're concerned about being infected, but they're also concerned about relatives that may have secondary illnesses. They're also concerned about colleagues who are pregnant. Schools are losing pupils and they're losing staff, and they will close of their own volition unless we have a plan to scale them back and provide essential childcare for those workers that still need to work and the children that will still need to go to school.
I understand why some parents are concerned, but I would also say that because the evidence is that children are not badly affected by this virus, it is important to take that into account. And also the point that he makes about people who need to go to work not being able to because of childcare responsibilities are very serious in terms of the impact that it could have, and so very important to take into account.
Job.
In the last 2 hours, the Prime Minister said that school closures will be kept, quote, under review, end quote. In the event of a school needing to close, can I ask the Secretary of State, who takes the final decision? Is it the government? Is it a local education authority? Or is it the head teacher?
It is the head teacher, and we have there are discussions with the Regional Schools Commissioner in England in these cases, and it's something that we are looking to address in the bill.
Paula Barker.
Thank you, Mr. Speaker. I'd like to join with honourable members in this House in placing on record my condolences to the families of those who have lost loved ones, and also pay tribute to the workers in the NHS working around the clock, and also those workers in social care. After a decade of austerity, our NHS and public health were already at breaking point, even before the current coronavirus hit our communities. And public sector workers have borne the brunt of austerity over those last 10 years. workers. The very workers who are expected to continue to provide services to the most vulnerable people in our society. Mr. Speaker, today I've been contacted by Paul, a critical care nurse in my constituency who has to self-isolate after developing a cough. He's been told he will not be tested. His skills, along with those of his colleagues, are vital to care for patients. And frontline staff need to be...
That we're going to have to stop the questioning because I've got to get everybody in. Just a minute.
Hey, Mr. Speaker, when will local government be provided with the additional ring-fence funding for public health? And also, when will public health be provided with their allocations for the new financial year?
Mr. Speaker, I've addressed the question on testing repeatedly. I'm delighted that we go into this with a record number of people in our NHS, and I pay tribute to each and every one of them.
Bob Shealy.
Speaker, COVID-19 will may put particular pressure on the dozen or so unavoidably small hospitals that serve isolated and island communities. We have one respiratory consultant on the island and we are ferry dependent. I know that he is very busy. Will he assure me that isolated communities will not be forgotten about when it comes to mutual aid, clear advice and the supply of medicine and equipment?
Absolutely, and I discussed it with officials today.
Afzal Khan.
Thank you, Speaker. Last week, I asked the Secretary of State why public health advice about COVID-19 had not been translated into any language other than English. Coronavirus has been present in the UK for over a month, and it has been 5 days since I raised this issue with the government, and yet there are still no translations available on the NHS England website. Can the Secretary of State provide an update on when exactly these will be made available? And will you clarify which languages the Department of Health are currently working on?
Yes, we're going to do this as soon as possible, but the honourable member will also, I'm sure, understand that we have just published new guidance that we've been working on, and this is a very rapidly evolving situation, so we will translate it as soon as we possibly can.
Thank you, Mr. Speaker. Can I endorse a point from the honourable member for Glasgow South West about having an hour in a supermarket, which I believe Iceland is already doing, where older people can purchase food before it is stockpiled, etc. But can it also include mothers of very small children? Because I'm afraid I've heard today of some scarcity in baby products, which is, of course, a great concern for us all.
Yes, I think this is a very good suggestion. It's one for the Environment Secretary and the supermarkets, of course, but it's an example of people pulling together to help the most vulnerable.
Jessica Lips.
Mr. Speaker, in answer to the question asked by the member for Leeds West, the Secretary of State stated that benefits couldn't be paid, that people had to take it through the benefit system, unlike maternity allowance, just as an example. And just to speak for a moment about the benefit system, my own brother, who is a universal credit claimant and an agency worker, has likely lost his job because he had to self-isolate for a period and it won't be kept open for him. He now, in the lag of universal credit, won't get anything until early May. Yep. The Secretary of State needs to tell us now when he will come before us with a package of financial benefits for business and people, because it is getting too late.
Well, we changed the law on Friday to take into account the need to make sure payments are made from day one in some of the benefits, but it is absolutely the case. It is absolutely the case that statutory sick pay is paid by employers. So for the self-employed, there is no employer, and we cannot put in place in the time that is necessary a whole new system. We need to make sure that people use the benefits system that exists.
Jacob Young.
Thank you, Mr. Speaker. Will the government consider giving the much-needed funds to support businesses directly to regional mayors and combined authorities, so that businesses in Redcar and elsewhere that are affected by the coronavirus can have the help they need without delay?
I'm discussing with the Chancellor of the Exchequer a further package of support because it is absolutely clear that the measures that we are having to take will have a very significant impact on business.
Streeting.
Thank you, Mr. Speaker. Professor Costello of UCL says the virus is particularly contagious at the early stages before symptoms present. Given the prevalence of this virus in London in particular, is the current government strategy based too heavily on responding to observable symptoms, and isn't there a case now for going further, faster, particularly in London?
Mr. Speaker, the point behind household isolation is precisely to address the concerns that he's raised, and also, by reducing all unnecessary social contact, we will help to reduce the sorts of transmissions that he talks about.
Thank you, Mr. Speaker. Will the Secretary of State explain how he and his team have been working to learn from the experience of other countries that are ahead of us in the curve, so that we can see the things that they've done well and the things they haven't done so well?
Yes, we're constantly looking at what's happening around the world and what people are doing and the research in order to try to make sure we calibrate the very best possible response.
Mr. Speaker, many of my constituents live in severely overcrowded accommodation or in single hostel rooms. There is a looming public health crisis in the short term and a looming long-term mental health crisis because of the conditions they'll have to self-isolate in. What advice and what is the Secretary of State going to do about those people?
Yes, of course, we're incredibly concerned about this, and this is reflected in the guidance that we've specifically put out, and is one of the many reasons why we encourage people to get outside, even if they're in household isolation, so long as they don't come into contact with others. Because, of course, I understand the consequences of the advice that we've given for people for her constituents.
Thank you, Mr. Speaker. Many of those who the Secretary of State will want to shield at the weekend and are self-isolating are in receipt of at-home social care. Can he be clear about the guidance he's going to give about whether they should still be continuing to be visited, or what else he would do to put in place to protect those individuals?
Yes. Of course, the further advice will go out for social care. We put updated advice out at the end of last week in knowing that this was a likely step, and there'll be further advice precisely to help people to address exactly that question.
Judith Cummins.
Given the anxiety from schools, colleges and universities around exams, would the Minister reassure students and staff alike that there's provision in place for exams to take place within the cycle of this academic year? And would he also reassure the House that in the event of school closures, there's provision in place to feed those children who are currently in receipt of free school meals?
Both very important points. Children who receive free school meals often receive their best, or in some cases their only meal, at lunchtime at school. And it's an issue I discussed with the Education Secretary over the weekend.
Damien Hines.
Mr. Speaker, my honourable friend from Folkestone talked about the importance of information consistency, but some constituents are seeing competing messages which look like they come from credible sources and are passed on in good faith. In the worst cases, not only do they mislead, they can even be dangerous. So can I encourage my right honourable friend to continue his work with the platforms, not only to ensure the primacy of the official information, but to actively work against that which disinforms?
Yes, he's absolutely right.
Claudia Webb.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. The Spanish government recently announced sweeping measures to take over private healthcare and requisite services like ventilators, testers and indeed face masks. We heard in the UK that the Prime Minister was indeed actually ordering the NHS to acquire resources from the private healthcare at a tune of something like 2.4 million today. Mr. Speaker, will the Secretary of State outline measures that the government will take to ensure that we put private health, that we put public health, public safety before private profit?
I'm absolutely delighted at the response of the private hospitals who are rising to this challenge and we're working very closely with.
Roberts.
Thank you, Mr. Speaker. Did my right honourable friend outline what discussions he's had with the First Minister of Wales to ensure that the plan is consistent and that constituents don't get mixed messages? And along those lines, would he appeal to certain sections of the media to realise the power of their platform and encourage them not to undermine the official advice?
Yes, it's very important. I was in Cardiff on Friday to discuss this with my opposite number who attended the Cobra today, and we're working very closely with the Welsh authorities who, of course, run the NHS in Wales.
Ben Lake.
What consideration has the government made of the possibility that some people, especially those living in London, may, in light of today's announcement, decide to move from more urban areas to rural areas? And will the Secretary of State reassure us that additional resources will be made available to local health authorities should there prove to be a significant shift in population?
Yes, of course, I'll keep both of those under review.
Graham.
Mr. Speaker, last Friday, the heads of all the NHS services in Gloucestershire held a conference call with the 6 MPs of the county, and very helpful it was, indeed, in answering all our questions and giving us information to share with constituents. Does my right honourable friend think this is something that could be done in every cluster of NHS around the country?
Yes. Yes, and I have asked Simon Stevens, the head of the NHS, to ensure that local trusts and CCGs keep their local MPs informed of what's happening locally, what's having to happen, and how they're responding. Now, of course, the NHS is incredibly busy at this time preparing, but I think that would be a good idea.
Alison McGovern.
Thank you, Mr. Speaker. What extra support will be available for pharmacists, and when will local authorities know what their public health funding allocation will be?
Well, the public health budget is going up. And as far as the pharmacists are concerned, they're an incredibly important part of the NHS family.
Bob Blackman.
Thank you, Mr. Speaker. The most serious people at risk are those with underlying conditions. Will the public health agenda being published promote how people can minimise those conditions, for example, giving up smoking and leading a healthier life, so that we can actually minimise the number of serious cases that are seen by the NHS?
Absolutely right. It is abundantly clear from all of the research into previous coronaviruses that smoking makes the impact of a coronavirus worse.
Gabley.
Thank you, Mr. Speaker. Every time the Prime Minister makes a statement on coronavirus and the advice changes, the 111 hotlines go mad. 111 call handlers are asking that the script changes in real time because without it they're required to keep to the script, and on Thursday there was a 3-hour delay before the scripts were updated. Please could the Secretary of State please look into this and change it for next time?
Yes, firstly I want to pay tribute to the 111 call handlers and the clinicians who have just done an amazing job over these last few weeks. I don't know what we would have done without them. The second thing is that the 3-hour turnaround of the script changes was an unbelievable task for those who implemented it. They did a magnificent job to turn it around so quickly, and I, of course, applaud them for doing so and would wish them to be able to turn it around even quicker, but they did an amazing job doing it that fast.
Jim Brown.
Mr. Speaker, the Secretary of State's announcement today will mean that large numbers of elderly and vulnerable people will be required to self-isolate. Will the government therefore coordinate all the volunteering organisations, because large numbers of people will be required to deliver necessities to those vulnerable groups?
Just like we've introduced a national effort for ventilators, so we are introducing a national effort for volunteers. And my right honourable friend, the Culture Secretary, is leading that drive.
Kevin Brennan.
Thank you, Mr. Speaker. In answering my right honourable friend from Leeds Central area, the Secretary of State made it clear he wanted everybody to be tested at home if they had the symptoms. What's the difference between the number of new cases currently and the number of tests that are currently available per day?
Well, our estimate of the total number of new cases is significantly higher than the available tests right now, and that's why we need to increase testing capacity so quickly.
Ben Everett.
Thank you, Mr. Speaker. I think something that will unite us across this House is our utter admiration for the great British public and how all parts of our society have responded to this crisis. Our public health officials, of course, families, communities, and today businesses that have heeded the call for ventilator production. Can the Secretary of State confirm that as well as the hotline to call, there is now also an email address to send your response to if you are a business that wants to contribute to the national ventilator effort?
Yes, there is. We've been absolutely overwhelmed with the positive response to the national effort for building ventilators, and that email address is up and running, and we're trying to engage with everybody who contacts us.
Mick Whitley.
Thank you, Mr. Speaker. Can the Secretary of State assure this House that if schools are closed because of the coronavirus, money's be made available so that lunches and hot food will be provided to those children in most need? Also, the fact that you did say you took advice from other countries, Ireland closed their schools.
We, of course, are looking at the impact of all the decisions that different countries have taken, and there'll be lots of consequences should we take the decision to close schools, but we have not taken that decision today.
Andrew Bowie.
Speaker, can I first pay tribute to my right honourable friend and indeed all of the staff and officials at the Department for Health who are working round the clock in an incredible situation to deal with this, and indeed his counterpart in the Scottish Government and all of her staff working, doing exactly the same north of the border. I know my constituents in West Aberdeen, Checking Card, and appreciate it. Can I ask if he knows if his right honourable friend, the Secretary of State for Transport, will be coming to the House any time soon to update us on any discussions he's having with the airlines industry? The maintenance of routes is very, very important to the economy of the north east of Scotland, and the survival of these airlines is vital.
Well, it is, of course, something I discussed with my right honourable friend, the Transport Secretary, who I'm sure will be coming to the House sooner rather than later.
Jim Furham.
Can I encourage people across the country to have complete confidence in the government's medical and scientific advice? That is essential for the safety of this country. But I could also encourage the Secretary of State to ensure that the population as a whole have confidence in their own economic futures. We spent £500 billion in this country bailing out the banks in 2008. We need to be prepared to go even further than that to make sure that people, for example, the 60,000 people in Cumbria working in tourism and hospitality, know their economic future is not about to be burnt.
I do understand the concerns that the honourable gentleman raises, right honourable gentleman, and I think it is important that these concerns are addressed. You know, coming from a small business background myself, I understand the impact that a change like this can make, especially in the tourism industry, which is so important to his constituency. We regret having to take the measures that we do today. And as I said earlier to the right honourable gentleman, the former leader of the Labour Party, this is something on which we're working at pace.
Thank you, Mr. Speaker. The Secretary of State should be congratulated for the calm and responsible leadership he's shown during this crisis. But can I draw his attention to the subject of a hugely vulnerable group, and that is children with immunosuppression, with underlying health concerns. The advice to them is still to go to school, but he will know that any virus can be devastating to them with the low immune system. Will he issue specific guidance to parents who have the concerns with children like these?
Johnson.
Thank you, Mr. Speaker. In talking to my local trust this afternoon, they're doing everything they can to prepare for a potential surge in COVID-19. But what they did say to me, the big problem they've got is knowing what to do if the schools close and what that then means in terms of the workforce and their ability to turn up to work. So can we please have an assurance that there will be a national childcare policy, particularly for key workers in the NHS?
Well, this, allied with the fact that children are safe at school because they do not have significant symptoms from COVID-19, is the reason that we are keeping schools open for now.
Sarah Brittley.
Charities and third sector organisations are also going to be deeply affected by this. Can the Secretary of State inform the House what support will be available to them, especially when they're trying so hard to help in our communities?
Well, my honourable friend is absolutely right to raise what is such an important point, because we need communities to come together, and we need people to come together to help out those who are badly affected by this. And of course that means supporting our charities to make sure that they can keep providing the sort of support which we're going to need in the weeks and months to come.
Kate Green.
If schools are to close, and I appreciate that's not the government's position currently, head teachers in my constituency have asked me to convey to the government that a particular priority must be given to child safeguarding, and that this should also become the priority for Ofsted. Will he discuss that with the Schools Minister?
I will. She makes a very good point.
Andrew Griffith.
Mr Speaker, British businesses, large and small, including those in West Sussex, stand shoulder to shoulder with the Secretary of State on the excellent work that he's doing. Can I commend the Advanced Manufacturing Initiative for ventilators, but encourage him to go much, much further into other hard-pressed categories across our health system and our social care system?
Yes, it's been extraordinary, the response to this crisis. Things are happening in this country that nobody would have wished, and things are happening faster than so many people anticipated. But people's ability to respond, even to changes that nobody would have wanted to see, has so far been in many cases remarkable. And we talk about, of course, the NHS and social care, but so many businesses also under intense pressure and under intense stress, looking to see what they can do to help.
In Paisley.
Thank you very much, Mr Speaker. The Secretary of State has made it very clear that it is no longer business as usual. However, for families and businesses up and down this kingdom, it is bills as usual. What measures specifically can the government take to introduce rates relief for families and for businesses, a VAT delay for the coming year, and importantly, by HMRC making sure that they give time to pay to people for the most critical bills for their businesses?
The Honourable Gentleman is right to raise all of those issues, and we will address them all.
Jason McCartney.
Mr Speaker, we're all looking for clarity in these uncertain times, and I've just been contacted by the owner of a cafe and a hairdressing business in my constituency. I've heard the strong advice for people to not frequent their businesses, putting them under a great chance of not being viable moving forward. Mr Speaker, a lot has happened since the budget last Wednesday. Does the Health Secretary not agree with me? It would now be useful for the Chancellor to return to the House this week and clearly lay out the latest raft of measures available to support businesses, large and small, employees, the self-employed and freelancers.
I will absolutely take that concern directly back to my right honourable friend, the Chancellor of the Exchequer.
Absana Begum.
Thank you, Mr Speaker. The government has talked of drafting in volunteers to provide care, but people with disabilities and complex needs often have some of the most complex of needs. It's highly unlikely that volunteers would be able to provide the care that is needed. How will the government ensure that people with disabilities will continue to receive the support to stay in their own homes?
Well, of course, volunteers have got a huge role to play in doing jobs that work for their skill set. But for many people, an incredibly high set of skills are needed to support people, for instance, those with disabilities that she raises, and supporting them to get the social care they need is a critical part of our response to this virus.
Brian.
And thank you, Mr Speaker. What steps is the government taking to increase the availability of high-quality masks and other protective equipment for NHS workers?
We're both distributing personal protective equipment across the NHS from the stockpiles and the supplies that we have, that we've got in place for this purpose, but we're also seeking to enhance the production of these because it's clear that we're going to need a lot.
Thank
you, Mr Speaker. Many pharmacies across the country refuse to take prescription requests over the phone. So can the Health Secretary explain what he's doing with the other health ministers across the UK to ensure that people can access prescriptions over the phone or electronically, that they're transmitted directly to pharmacies, and relax restrictions on the supply of medicines, for example, so people get a 3-month prescription rather than a month?
Yes, he's quite right to raise this. In England, where I'm responsible for it, we are addressing all of these points, and I'm sure that the devolved nations are looking at them too.
Thank you, Mr Speaker. Given that the new advice today is that people should remain at home for up to 14 days if they have a high temperature or a continuous cough, I wonder if my right honourable friend can clarify for constituents what actually constitutes a continuous cough. Is it half an hour? Is it half a day?
It's a cough that doesn't go away. It's not an irregular cough. I can't give any more detail on the specific advice than that. It is a continuous cough. That is the best way to describe it.
Kyle.
Thank you, Mr Speaker. If pubs are unsafe, why is it being left to customers to decide whether they should go there or not?
Because our advice to everybody is to reduce unnecessary social contact in order to protect themselves.
Philip Pollabo.
And the personal resilience of the Health Secretary during this crisis, and also all the staff at Kettering General Hospital. Do we have any lessons to learn from the German experience, where they've had 5 times as many confirmed cases, but only a quarter of the deaths?
I've discussed this point with my German counterpart, and I'm afraid I wish that there was something that we could learn from that particular point, because it's important. We think that the reason for that difference in ratio is because the early cases in Germany were largely from people who'd been skiing in northern Italy and therefore were more healthy, whereas this disease, the mortality of this disease is very strongly correlated with age.
Mohammed Jassim.
Thank you, Mr. Speaker. I live with my 80-year-old mother, my wife who has a heart condition, my daughter and sons who attend educational settings, and my 3-year-old grandson. What advice can the Secretary of State give to multi-generational households like mine, where self-isolation is not a viable option and alternatives are far from obvious?
This point is an incredibly important one and directly addressed in the advice that will be on the gov.uk website.
Leslie Buchan.
I have been approached by many 70-year-old plus people who are still in full-time employment. They want to know that if they are still healthy and they are still willing to go to work, that the government is supportive of them doing so.
Yes, the shielding measures where we insist on the lowest possible social contact, they are for people who have existing conditions and will be contacted by the NHS. For those over 70 who are healthy and, for instance, as she says, are in work, we strongly advise them to minimise their social contact.
Alison Thewlis.
Mr. Speaker, to prevent people from stockpiling and panic buying infant formula, will he speak to supermarkets and perhaps insist that they will limit sales to perhaps 2 per family to prevent that? And in the event that breastfeeding support groups are not able to meet, will he direct people to the National Breastfeeding Helpline, which runs from 9:30 to 9:30 every day?
I'll look into the second point. On the first point, that is happening. Those conversations are happening.
Robin Miller.
Thank you, Mr. Speaker. I congratulate the Right Honourable Member for his openness and the quality of the information he's giving us. Could he offer some guidance, please, to the large number of religious communities, churches, mosques, gurdwaras, on what actually constitutes a large gathering of people?
Well, we do address this in the advice, and this is a very important point. We've taken advice on how to respond to this crisis, including from our ethics committee, which includes representatives of the major religious faiths. And it is true that in our advice to avoid unavoidable social contact, we do include religious groups in that. We've seen from elsewhere in the world how sometimes it is through religious gatherings that this virus can spread. So with the deepest regret and with the heaviest of heart, we do include faith groups and gatherings of faith within the advice.
Susan Malhotra.
Can I ask that the Secretary of State and the Chancellor at the very least write to all members of this House this week with what they understand to be the measures that will be taken to support the self-employed and small businesses in our constituency, because that information is absolutely vital. Could I also just ask him about local authorities, because they are going to be at the front line of supporting family hardship as well as ensuring services reach those in need. That's a mammoth effort at the same time as employees having to be encouraged to work at home. So what financial support, including hardship funds, is the government providing to cash-strapped local authorities, and how, alongside the great and enormous effort being provided by community organisations, is he also going to ensure safeguarding of older people?
Yes, these are all important considerations, and on the financial ones, it is, of course, a question for the Treasury, who are looking at how to address all of these things.
Jerome Mayhew.
Thank you, Mr. Speaker. Hundreds of thousands of students are currently revising for their public examinations. Does the Secretary of State have a contingency plan for GCSEs and A-levels to be sat on time?
That's a matter that the Education Secretary is considering.
Lillian Greenwood.
phone.
Mr Speaker, 70% of people over the age of 70 are living with hearing loss, so it's welcome that most public health messaging on TV is subtitled. However, for those whose first language is British Sign Language, reading written English can be really difficult, and much of the public health messaging is inaccessible. Given the seriousness of the situation, the fast-moving situation, will he ensure that all press conferences featuring a minister, the chief medical officer or the chief scientific advisor have a BSL interpreter present? And how is he ensuring that the communication needs of those with hearing problems are being met when they require health treatment?
It's an incredibly important point. Many of the statements on coronavirus from this dispatch box have been signed, and I understand that the press conference that the Prime Minister gave today with the chief scientist and the Chief Medical Officer was also signed on the BBC.
Thank you, Mr Speaker. Can I go on record too for thanking the fantastic work of our NHS and care workers and pay tribute to the immense public support out there by community organisations. Whilst we are no longer performing community testing, with consideration being given to testing of NHS staff as a priority, will my right honourable friend advise if this will be extended to social care staff, the police and teachers to ensure that our frontline services continue to operate?
Yes, of course, this is an incredibly important point, and Public Health England are addressing the order of prioritisation, and we're also trying to drive up, as we discussed many times earlier, the number of tests available.
Schools are closing. London Oratory School in Fulham, which had 1,300 pupils, closed today. And one effect of that is that other schools in the vicinity then come under pressure to do likewise from the school community. There's no criticism of anyone, but can the Secretary of State review and clarify the policy on schools and what happens if they have to downsize and what happens if the policy changes?
Yes, we are of course reviewing all of those points, and there are some measures in the bill tomorrow directly to be able to address this.
Smith. Thank you, Mr Speaker. The week before last it was shortly, last week it was imminently. Does the Secretary of State know when the public health budgets will be announced, and if he does, could he shed some light on it?
It's as soon as possible. There are so many things that we need to get on with, and this is one of them.
Stephen Kinnett.
Thank you, Mr Speaker. My honourable friend, the member for Leicester East, referred earlier to reports that the private health industry is planning to charge the NHS £2.4 million a day for the rental of 8,000 beds. Does he really feel that that's the right way to go, given that this is a national effort, that we are all in this together? And what steps will he be taking to ensure that that private health providers are doing their bit?
I do think it's the right way to go to make sure that private sector capacity available to address this crisis, yes, and it's a matter of all working together to deliver.
Emma Hardy.
Thank you, Mr Speaker. My constituent can't get mortgage payment support because she hasn't got a sick note to go with being self-isolated. Yes. When will electronic online sick notes be available through the NHS 111 service?
Yes, we are fixing that, but we are also changing the law to ensure that that people who are self-isolating are clearly deemed to be sick for these sorts of purposes.
Dr. Rupert.
Mr Speaker, among those who can't work from home, who feel vulnerable, are GPs. So can he heed the advice of the locum who came to see me and sort out the inconsistencies of 111 that had been diverting people to surgeries? And also, can he do away with the box-ticking target culture that makes them terrified to perform a number of consultations in a set amount of time? And also get rid of the quaff appraisals, which are just unnecessary, and let doctors be doctors.
Well, my message to everybody in the NHS is that they should do what they need to do to keep people safe in front of them, and we are reducing a whole load of the bureaucracy that gets in the way, for instance, with measures from the CQC as one example, to make sure that people can just do what's right in front of them. She says GPs can't work from home. Of course, sometimes some GP appointments do need to be face-to-face, but increasingly they can be over the phone or over Skype, and so they should be.
Vendra Mishra.
Thank you, Mr Speaker. Several members have raised the concerns about care staff, and as we all know, many of them are on zero-hour contracts and work for multiple providers. This means that they struggle to prove that they're eligible for statutory sick pay, forcing them to choosing between protecting their clients and paying for their bills. What action will the Secretary of State take to help care staff who are not eligible for statutory sick pay and who cannot prove their eligibility?
Yes, this is an issue that I discussed with the Honourable Gentleman, the Shadow Health Secretary, earlier today, and the package of measures in the budget addresses this as much as is possible, and we're prepared to go further if that's what's needed.
Deputy Peacock.
Mr. Speaker, I've been contacted by constituents concerned by the lack of health and safety and testing at our borders. Does the government have plans to implement stricter measures at our airports, ports and rail terminals?
Well, now that there is onward transmission in the UK, those sorts of measures are less efficacious. At the start of this, of course, we have been doing that all along and strengthening it. But there are also those who said go further and stop all of the flights. Of course, you know, the Italians were the ones who stopped the initial flights from China and ended up as the European epicenter of this anyway.
Alex Norris.
Thank you, Mr. Speaker. The Secretary of State has indicated a willingness to revisit the statutory sick pay issue if, as many of us think, the current arrangements do not go far enough. When will he make that assessment?
We're making it constantly.
Russian Arabi.
Thank you, Mr. Speaker. Coronavirus has already claimed the life of one of my constituents, and my thoughts are with him, with his family. What action will the Secretary of State take to prevent the closure of the Mildmay Hospital in my constituency, which can relieve some of the much-needed pressure from the Royal London Hospital? And can the Secretary of State explain what action the government will take to put restrictions on the rising price hikes of the supply side of goods, and also restrictions on panic buying, which is understandable given the guidance is changing, but we need to get a grip on it to protect vulnerable and poor people in our constituencies?
We are looking at all of these points, and with respect to the last one, this is a matter that the Environment Secretary, responsible for the food supply, is looking at very closely. We are confident in the food supply of this country, even in the grip of this crisis, but we've got to make sure that people behave responsibly in buying only that which they need.
Lesterson.
If the advice to customers is that it's safer not to go to bars, restaurants and theatres, presumably the same advice applies to members of staff in the hospitality sector. So why isn't the government saying to all businesses in those sectors that they must close, which then puts them in a much better position to claim on their insurance?
We've taken a decision on health grounds to make the changes to the advice that are deemed necessary according to the scientific advice and the medical advice to keep people safe. I understand that there are consequences, huge consequences of that for businesses right across the country, and my right honourable friend, the Chancellor, is leading the work to support these businesses.
Mr. Speaker, in Shetland we have 15 of the 171 confirmed cases in Scotland. That's almost 9%. From an island community of 22,000. In normal circumstances, anyone requiring intensive care in Shetland is taken by air ambulance to mainland Scotland. Because of the nature of coronavirus, we can't do that. I understand that the military assets will be engaged for that transportation, but clinicians tell me that there's no understanding of the protocols and there's not even yet been a dress rehearsal. Will the Secretary of State speak to his right honourable friend, the Secretary of State for Defence, to ensure that all necessary communication happens, to ensure that when this service is needed, it will work?
Yes, I will, and we'll make sure that we support people on all parts of these islands and all islands that are part of these islands.
Sorry.
Thank you, Mr. Speaker. I've been contacted by a constituent of mine in Erith and Thamesmead. His elderly grandparents are stranded on the Fred Olsen liner. Can the Secretary of State please tell me what action he would be taking to provide support to those stranded with coronavirus?
Point. My right honourable friend, the Foreign Secretary, is leading on this response. We've already provided medical capability to try to support people who are on board. It's a difficult situation, as I'm sure that she will understand, and we're doing the very best that we can.
Speaker. In recent days, I've been speaking to health workers across the sector and also to our local council about our schools. I understand there's a strong undersupply of hand sanitizer, and Warwickshire County Council tried to order £19,000 worth and could only get half that for its schools. Can the Secretary of State update us on what he's doing in terms of generating production for that?
Yes. We are keen to see further production of hand sanitizer. There are not many hand sanitizer production plants in the UK. And I would add that soap is better than hand sanitizer, but nevertheless it's something that we're working on.
Matthew Pennycook.
Thank you, Mr. Speaker. Could the Secretary of State for Health please speak to his right honourable friend, the Environment Secretary, about what more can be done to guarantee essential food supplies to those who are symptomatic and self-isolated? Right. In the absence of his national volunteering scheme, which is not yet in operation, at least in my part of South East London, people are phoning me over the weekend to say they can't get essential home deliveries, they've been cancelled, they can't get them for 3 weeks, they've got no friends or family around, and they're too sick to go out.
Yeah. Here.
I talk to the Environment Secretary almost daily about this. It's obviously incredibly important, and it's important that within communities people help each other to be able to get essential supplies.
Thank you, Mr. Speaker. This morning I visited Turney School in my constituency, a special educational needs school with an outstanding track record of the education it provides for its students. As well as education, the school also provides vital emotional and social support and respite for families. And the staff there are very worried about what will happen in the event that the school has to close, about the provision of social care for families who often live in overcrowded accommodation, and 90% of whom are eligible for free school meals. Can the Secretary of State say what measures he is taking to ensure that social care capacity for such families will be expanded in the extent that schools are forced to close?
The Honourable Lady, Mr. Speaker, makes an important point, which is that the consequences of closing schools is very, very complicated, and is something my honourable friend, the Education Secretary, is addressing directly.
My constituents in Bradford West, for the Muslim and Jewish community faiths, have concerns about burials because they want to bury as soon as somebody dies. Now, given that we might sadly lose people to this virus, what conversations has the Minister had with religious institutions across the country with regards to this?
The Community Secretary leads on this question because ultimately local authorities have got an incredibly important role to play in making sure that this happens smoothly. There are further powers in the bill that will be published, the details of those will be published tomorrow, to try to make sure that we have what we need to address the difficult situation.
Thank you, Mr. Speaker. Over the past month, we've heard an awful lot about the government's science-based strategy to dealing with this crisis. I'd like the Secretary of State to provide with me and my constituents an idea in terms of the modelling that you are using, so that we can understand, given the herd immunity strategy you seem to have been pursuing, just how many fatalities we could be seeing in this country, and if you are still pursuing that strategy, or if you've changed strategy instead to go in the direction of actually saving lives.
No, we're very clear that herd immunity is not part of our plan, and it's a scientific concept. It is not a goal or a strategy. And on the first part of his question, yes, we will be publishing that modelling.
Yes. In the interest of transparency and public confidence, can the Secretary of State just clarify whether he will be publishing the advice that explains the rationale for how testing will be expanded, so that people understand what groups are going to be tested next and how those cohorts are going to be prioritised?
I'll look into that question and get back to him, yes.
Karen Buck. People without a home of their own have particular challenges when seeking to self-isolate, which puts both their own health at risk and that of the wider public. Can the Minister assure me of two things? Firstly, will everybody who is street homeless be guaranteed the opportunity to self-isolate if they start showing symptoms, because people are being turned away from shelters at the moment? And given that tens of thousands of people are evicted every year, will he take action now to ensure that more people are not added to the homelessness total?
This is a very important point that's being addressed by my right honourable friend, the Community Secretary, along with the mayors and the local authorities who lead, in many cases, in the provision of these sorts of services.
Hopkins.
Speaker. Many local services in my constituency are supported by the third sector, such as charities like Luton Food Bank. They're going to be hit by a double whammy of many of the volunteers being 70 or over or living with people who may have long-term conditions, and equally having to cancel large fundraising events because they're large gatherings. What support can be provided for those organisations?
Well, in answer to a previous question about charities, I made the point that we have a charitable sector who have a huge role to play, including with the increase in volunteering, in the response to this unprecedented crisis, and we'll support them in whatever way we can.
Robinson. Speaker, and thank you for your generosity in letting this statement run into the Health Secretary for dealing with all the questions. What advice does he have for my constituent, Mr Emerson, who is in London today to collect a private script for medicinal cannabis for his daughter, who at 3 years old relies upon it? He can only cash the private script in London, and he has to travel to London every month. He has asked for 3 months' supply in case he can't travel from Belfast to London in the months to come. Could the Health Secretary give any advice or guidance for him or for the Chief Pharmaceutical Officer?
We're trying to address the precise point about the supply of medicinal cannabis products through a change to the Home Office regulations anyway, but also the advice is against unnecessary travel, and that sort of travel that the Honourable Gentleman describes sounds very necessary to me.
Alex Sobel.
Thank you, Mr Speaker. Later, at the height of the crisis, the Secretary of State will be judged on the answers he gives today. At the beginning of the crisis, there were only estimated 5,000 ventilators in the NHS. Can he tell us exactly how many ventilators he has purchased, and what the modelling says about how many ventilators we'll need at the height of the crisis, and whether we will be able to get everybody on a ventilator at that point?
As the Honourable Gentleman knows, from my previous answers, this is not the way that we're addressing this question. The way we're addressing this question is that we will buy as many ventilators as are made. It's not a question of putting a target on it. We are just going after as many as we possibly can.
Rosie Duffield.
Thank you, Mr Speaker. Gaps in NHS capacity, particularly in mental health services, have been filled in recent years by excellent local charities in my constituency, such as the Home Start service in Canterbury, which supports isolated, disabled and terminally ill parents in their own home. However, they have now almost completely run out of money, and I'm going to ask the Secretary of State how he suggests that I support them to continue now that we need their services, as he alluded to, more than ever.
Well, I think that if the Honourable Lady speaks to her local CCG, to the extent that the charity, who I pay tribute to, can support the local effort, then the CCG will be best placed to make that judgment.
Durham.
Thank you, Mr Speaker. Following the Secretary of State's statement this afternoon, IPSA have announced that their office will be closed, with staff who are able working from home, and their phone lines will be closed, and all inquiries will be answered by email. Will this be the approach of the other government departments in response to this crisis?
Mr Speaker, I'm responsible for many heavy responsibilities. I hope I've answered questions about activities of almost every department of government, but I am not responsible for IPSA. It is not a department of government. It is independent, as we well know, and I'm sure that Mr Speaker will have heard that the concern raised, and I'm passing this one to you, sir.
Thank you. Chris Elmore.
Speaker, could the Secretary of State set out in more detail in terms of foreign medical staff who are brought back in to deal with the virus are put onto the correct registers and also have the most up-to-date qualifications and training that they need to deal with it?
Yes.
The last but certainly not the least, Jim Shannon.
Mr Speaker, I have the strongest legs in this chamber. Thank you very much. Minister, could I ask what advice the Minister has given in relation to discussions that have been had with banks and lenders regarding mortgage payments? And would the Minister, in his capacity of answering for every department, be able to tell us if there would be specifically a 3-month freeze on mortgage payments, which would be extremely helpful? After all, banks and building societies have a role to play as well.
My right honourable friend, the Chancellor of the Exchequer, is in a constant dialogue with the Governor of the Bank of England and with the banks themselves. There were active discussions over the weekend about what further measures can be brought forward. He's right to ask this question of a different government department of me, and we are working incredibly hard right across government to address this concern and indeed every concern that honourable members from all across the House have rightly raised this afternoon. And may I say, Mr Speaker, I'm very grateful for you allowing me to make this statement at an unusual time, and I will commit to coming before the House whenever necessary to answer each and every concern.
Point of order, Clive Method.
Mr Speaker, we all appreciate the work and the efforts of the Secretary of State for Health and his attempts to answer our questions this evening. But there are questions that he wasn't able to answer from several other departments, such as the Treasury, Business, DWP, Education, Local Government, DCMS, Transport. So through you, Mr Speaker, can I ask, when are we going to get statements from other Secretaries of State so that we can quiz them properly on the arrangements the government are making on these very important issues we're raising on behalf of our constituents?
Very good point. What I would say is, obviously, it's a matter for the government on it tables its business, and I think that message will have taken on in furnace the government. It wants to work with all sides of the House to ensure that we put the country first, and I'm sure that message will have been heard. Right, can I now move on to... Can I move on to the business that was continuing on the budget debate? Damien Collins.
Thank you, Mr Speaker. Following on from the statement we've just heard,